Dr. Tucker's Vision Center. I am so happy to welcome back to the show once again, Dr. Tucker. Good morning.
Good morning. Good to be back.
We're going to talk this morning about age-related macular degeneration, which is kind of a mouthful.
Yes,
but this is interesting. Tell people what it is. How do you describe what it is?
Macular degeneration occurs in the retina, which is the inner layer of the eye. The macula is the area where as you look straight at somebody, that's where they focus. Like I look at you, your face is focused on my macula area.
Okay.
Okay? And what happens with that is the cells in that area called cones, mostly cones in that area. You heard of photoreceptors, rods and cones. The cones in that area start dying off related to poor circulation or increase in blood vessels in that area that are very easy to bleed and cause fluid in that area, which damages the tissue.
So, and then in turn, I guess, is it difficult to see then? Is that when you start having vision
the movie
problems?
movie screen where they cut out the center of it.
Oh, geez.
Okay.
That's not annoying at all.
Yes, it's very annoying. The key thing with that also there is you have to realize you never actually go totally blind normally in macular degeneration, but the central vision is gone. You still have your peripheral in most cases, but the central vision is gone. So then that affects you on reading, writing, looking at TV, certainly can't drive a car, those type of things. So it can be very devastating to people.
Is it just purely age-related? Is this something that happens?
In most cases, it is age-related. You may see it in an earlier age, but it doesn't happen very often. It's mostly somebody over 60 or 65 where you will see this.
All right. Well, is there any good news? Is there treatment? Can you fix it?
Yes, there is treatment. The wet variety, there are several different treatments for that, from lasers to...
There's two different type of varieties.
There are two different types. The wet variety is the one where you have blood leakage or fluid leakage in that area. Sometimes you can have shots or laser work for that to help stop that. The other is dry variety, where the tissue is just dying off. That is a much more difficult treatment thing. There's really not a whole lot there for that, other than vitamins and other things trying to keep it from getting any worse.
Ah, okay. Is there anything to prevent it?
Well, certainly you need to make sure that there's no smoking. You need to watch your diet. The more vegetables you have, the colored type vegetables, the better off you are. Sunglasses outdoors are very critical. Ultraviolet
Are these all
radiation.
things that maybe start to age you faster too? Is that why it then just takes a toll on your eyesight in this particular?
A lot of the macular degeneration things has to do with your overall health and circulation.
Okay. All right,
so if those go
sense.
down, then you may have more problems. It can be family related. It can be some genetic, hereditary type thing. Certainly, if you have both mothers and fathers and siblings with it, then you had better be very careful. Get checked on a very regular basis, and certainly once a year to look at that.
Is there anything that maybe kind of comes up first, or is there any kind of sign or symptom that?
In most cases, the patient doesn't even realize they have a problem till it gets pretty bad.
Okay.
Okay. And if you catch it very early, there are certainly some things you do related to lifestyle and vitamins and those type of things that may slow that down and keep that from getting any worse.
Is it something that gets checked up checked on your regular
eye exam? If you have a regular eye exam,
so again, it goes back to how important those are.
How important regular eye exams are. And the importance when you get an eye exam, make sure you get dilated and they're looking at that retina.
Is that what they're doing when you get dilated?
Yes, that's one of the things they're looking at. You're looking at your blood vessels, your overall retina, your optic nerve, and the macular area to make sure it's perfectly good and healthy.
Okay, so the take home this morning is to
regular
get that eye exam.
exams.
And how often do we need to have those exams done?
Well, the statistics show if you're every decade 40 and above, your statistics of eye disease increases exponentially. Okay. So it goes through the roof. So I look at it, certainly by 40, you should be getting an eye exam every single year. Okay. Okay.
So after 40 every year.
After 40
before
at
that,
least. Before that, maybe every year or two is fine, depending on what you have going on in your family history.
If someone's watching this morning, wants to come meet you, find out more about your office, what do you tell them to do? What do you recommend that they do?
Call our office, 656-1778, or go to our webpage, tuckervisioncenter.com.
And you're doing another great offer for our viewers this morning, so explain what you want to do for them.
The first pair of glasses, you would get 20% off. Second pair, you would get 40% off.
Easy enough. Great discount just for saying, hey, I watched you on the Morning Blend. Dr.
That's
Tucker,
right.
we love having you here. Thank you so much again for what you do for our area and helping us all see better and live happier lifestyles, healthier lifestyles, certainly with our eyesight. Thank you, Doctor.
Thank you.
For more on Dr. Tucker and his office or his offer, just head to our website, fox4morningblend.com.
We'll be right back with one last look at your Fox forecast.